Hi everyone, welcome to today's session. Today is Friday, October 18th, and then our session will be about Lifewise, ISHIP, and Mychart. So thank you for joining us with Circle of Friends. Here's our agenda for today. Part 1, we will talk about what ISHIP insurance is, and then the ISHIP coverage. What does the insurance cover, and what type of support does this insurance offer? And part 2, our peer advisor at Circle of Friends, Jessie, will be leading a part 2 and introduce how to see a doctor in the United States, what to do when you're sick. And then we will talk about part 3. We will talk about Mychart for Husky Health Center. I'm apologize for the typo over here. We will talk about how to sign up for Mychart, how to log in, and what is the Mychart app. Also, how you navigate Mychart. Lastly, we will talk about Lifewise. Lifewise is the insurance company that provides ISHIP insurance. ISHIP insurance is a insurance plan that falls under Lifewise company. So we will talk about how to activate your Lifewise account and how to navigate your Lifewise website. So yes, just like that, our keywords for today is Lifewise, ISHIP. How Health Center is now renamed as Husky Health Center, and number 4, Mychart. And then here, right middle in the screen, we have an example of a Lifewise ISHIP insurance card. So yeah, let's continue. First of all, I want to talk about ISHIP coverage. We have a brochure that covers everything you need to know about ISHIP. Don't worry about saving the link. We will share all this link with everyone via email if you attended our event and then enrolled, sign up. So type your name and email in our sign up form. So this brochure, if we click the brochure, it leads you to the iShip insurance plan. And then if you look in detail, you can see that this insurance plan, everything that you need to know about the insurance plan is listed in this 91-page brochure. So there is, plan year, deductible, copay, copayment, coinsurance, from all those basic information to what is this insurance covering. It covers, covered services, whether what is it does not cover the exclusions and limitations, and then how does this insurance work with other plans and other insurance. So if we scroll down, we see that in the USA, we have 3 type of networks. This is very important to know because your insurance covers differently in different type of networks. So number 1 is the campus clinic providers. For our campus clinic will be Husky Health Center. It's on campus. It's next to the, I think it's Haddaford Hall on campus. And we have a chain of different clinics or hospitals that is called in-network providers. I will be introducing how do you find the in-network providers and how do you distinguish in-network and out-of-network. But in short, in-network providers, this insurance covers more money, so you pay less, insurance pay more. But out-of-network provider, you have to pay more and insurance pay less. So it's very, very important for you to know the in-network providers of iShip insurance. And when you are sick, unless you have to, you will want to go to the in-network provider compared to out-of-network providers. So as you can see, we have an individual deductible. So every quarter when you get sick, you will deductible means you will have to pay this out of your own pocket. So you will have to pay this amount for your insurance to actually work. So if you go to campus clinic providers, there is non-deductibles, which means if you go to our Husky Health Center on campus, everything will be covered by insurance. I mean, not everything. You will have to pay your 30%. It's covered later over here, but you will have to pay your amount. But for the very first dollar you spent, your insurance will be covering part of it. But for in-network and out-of-network providers, the first $100 of every quarter, you will have to pay it out of your own pocket. So let's say you went to the in-network provider and then your bill is $200. So you will have to pay the first $100 with your own money. And then starting at the second $100 of the $200, you will pay part of it, and then your insurance will pay part of it. Yeah, hope that makes sense. Let me know, type in the chat if you are confused about any of these. And the individual out-of-pocket maximum is for campus clinic and other in-network providers is $3,400. So if, let's say you are very sick, for this entire year, the maximum that you pay is $3,400. And then once it hits $3,400, I apologize for the mispronunciation. But so starting at $3,500, the insurance will cover everything. So there's no more out-of-pocket money that you will need to pay. If you are in a family plan, so if you have a kid or if you have other family member added with your ISHIP insurance, it will be a family deductible, and the money amount do varies compared to individual deductible and out-of-pocket maximum. Yes, due to the lack of time, I won't be going too much in detail of this document, but I will link this document both in the chat and in your email that you will be getting, and you can look at it in detail. So to summarize, ISHIP insurance covers a lot of things. It covers common medical services, covers your non-hospital urgent care centers, covers preventive care. So you can get exams, screening, immunizations with your insurance. You can get x-ray, lab imaging, you can get vision, you can get different prescriptive drugs. All of those are covered in this insurance. Surgery, emergency services, ambulance services, urgent care centers, hospital, mental health, maternity and newborn care, all of this are covered under this insurance. And then different depending on the illness and whether you are visiting an in-network providers or out-of-network providers, the amount that you have to pay is different. So I will link this in the chat, and I would highly recommend everyone to take a look at it in your meantime. And let's move on to our second slide. So yeah, this is what I covered. So at UW, there is an office called the ISHIP office, and this office is extremely helpful. They offer daily support. They do offer daily support over Zoom. They offer drop-in advising. They also have email and phone number. They also offer virtual front desk hours. So if you have anything that you have questions about your ISHIP insurance, you have a question about your account, your insurance is not working, please feel free to reach out to the ISHIP office. You can Google ISHIP office, and then their link should pop up, and you can also click the link in our slide or you send an email to Chris Desert. I will turn the mic to our speaker, Jessie.
Okay. Yeah, should I share the screen?
Sure. I can stop share and you can reshare.
Okay. Let's see. Okay, so just 1 second. Okay. For this part, I'm going to talk about where and how to see a doctor, how to get medicine, and we will go through Mychart and Lifewise later. First of all, if this is a life-threatening situation, please call 911 immediately. We don't want you to wait in line in the clinic with a really terrible situation. If it is urgent but not life-threatening, you can visit the urgent care at UW. There are a few locations where you can get the urgent care, but I believe the one in Ravenna is the closest. If we click on that, or if you can search like UW urgent care in Ravenna, you can easily get access to their website. Here they list their phone number. You can just call them to schedule an appointment if you need a primary care doctor. They also list their hours here as well. I've been to their urgent care twice. Once for my mom and once for myself. Keep in mind that if you ever have to go to the urgent care, you are going to wait for a long time to see a doctor or a PA, which is physician assistants, because there are always tons of people waiting in the emergency room. So just be prepared to wait for a long time. And yeah, their typical hours are from 10 to 8 on weekdays and 8 to 6 on weekends. It usually takes 6 minutes to drive there from campus, or you can take the bus. It usually takes around 12 to 15 minutes to get there, so it's easy to access. Let's see. Yeah, if it's not an emergency or like not a life-threatening situation, you just, let's say you catch a cold or like cough really bad, you can go to the Husky Health Center, and this is their phone number. You can call them at this number and ask them for a time slot that you can see the doctor directly on the day you call. Like if you call them, you don't have to wait for days or weeks. You can just go on the day you call, but just make sure you call them first. Do not just walk in. I don't think they accept any walk-ins right now. And also UW also offers 24 hours nurse advice through the community care line at 206-520-7511, which is right here. You can call this line for like urgent medical questions after Husky Health Center is closed. A nurse can provide advice, suggest treatments, and make arrangements for emergency care. To speak with a nurse, stay on the line and don't press 1 for the virtual clinic. Another option is to call Lifewise 24-hour nurse line. It is a free and confidential service that provides general information and advice on what to do for a medical concern. You can call any day at any time. Basically, there will be a registered nurse to ask you questions, listen to your concerns, and help you decide where and when to seek treatment. So these are all really useful resources you can use. Yeah, this slide is just like a health-related context. Like I said before, you can go to Husky Health Center and this is their phone number. You can just call them to schedule an appointment. You can also save $100 deductibles each quarter if you're a UW student. And here's the number of the UW dentistry faculty practice. The ISHIP health insurance also can cover like $1,500 per year. And here's the UW Counseling Center. You can book a session by calling them by this number. And you got 3 to 5 free therapy sessions each quarter. And here is just some help. Yeah, here's just for a second. Okay. Shinya, do you know what is this QR code for? Because I'm not really sure about that.
The QR codes leads you to the Lifewise ISHIP page, and then it also shows the ISHIP coverage overview.
Okay. Yeah. So those are really helpful information. Should I post this link to the chat?
Sure.
Copy link address. Yeah, I'll post it later after this. So for getting the medicine, we have a bunch of pharmacies you can visit. We got pharmacies in Safeway, Bardell Drugs, CVS, and Walgreens. You can get the over-the-counter medicine here, such as like some cough medicine, cold or fever medicine, or like nose spray, let's say. These are non-prescription medicines, which means you can buy them at any pharmacy's counter. And here is a guideline for people who may be struggling with mental health. I will also post a link later. If you ever feel like you need some support in terms of mental healthy, you can call them or email them right here if you need help. And if you want a specific doctor you want to visit, you can go to the Lifewise website and click find a doctor. And I believe they will have their information, like phone numbers on it that you can call to schedule an appointment. I don't think I can show this to you guys because I personally don't have Lifewise insurance plan. So yeah, you can, and also you can always ask them for an interpreter when you are scheduling your appointment. Some of them do offer different language supports, some do not offer, but it doesn't hurt to ask if you need those types of services. And Shinya, do you wanna show them how to go through this, like how to find a doctor on Lifewise website?
Yes, I can. But at the same time, I feel like this screenshot is very self-explanatory. So if you go to, do you want me to share my screen again?
Yeah, I can stop sharing mine.
Okay, perfect. So yeah, we put a lot of screenshot here for everyone. So everyone, once you go to Lifewise account, and you will be able to find a place that says finding in-network provider or out-of-network provider. It's very obvious. It's right there on the top. And then you can, if you click that, you can search through what are the nearest they have like different filters, and then you can search through the nearest clinics, different dental care, other services, mental behavioral health. We are listed over here, they tell you about primary care, different care. You can click in and then search what's in network and what about the network. We will provide the website link to the email later that we are going to send it out. So don't worry about it. And then you can play with the link and explore what's all the clinic near us. And for part 3, let's talk about Mychart. Mychart is an online patient portal that's used by Husky Health Center and UW Medical Center. So patients can easily access their medical records. They can text their doctors using Mychart. They can check and pay bills or make appointments. So it's a very useful and important tools to have. And I will hand everyone a PDF, and then that PDF talk about how to sign up and log in Mychart in a lot of details. So don't worry. But in brief, if you already made an appointment with Husky Health Center, like you got your vaccines there, you should already have your MyChart account. So if you already got your vaccine at the Husky Health Center, you can go to your UW email account and search MyChart. You will probably see an email like this. So and then you will provide a link for you to sign up for MyChart. And if you haven't had a chance to visit the Husky Health Center, there's two ways. Number one is that you can call them and make an appointment with them, and then you go, and then they will send you the same email and ask you to sign up for Mychart through email. Or number two is that you could start early and sign up using a website and the link, which I will be providing in a minute or so. And if you are going with the number one route, you call them, made an appointment, or already had an appointment with Husky Health Center, but you don't see the email, you can also use the second route, to go to the website and then use the sign up without activation code option. I will provide the link to this website very soon. And if you are downloading the MyChart app in your phone, make sure you use this app. There is a different app called Mychart, and that's a different one. And then we talked about Lifewise is the insurance company that hosts ISHIP insurance. In your UW email, you should already received an email from Lifewise. So if you go to your UW email and search Lifewise from your inbox, you should probably already gotten an email says, oh, you are now enrolled in ISHIP plan or different Lifewise plan, and then here is your identification and suffix number. This identification and suffix number is very, very important. It's your individual number. Nobody else has this number. So you could use this number to identify yourself. So you could possibly just bring this number to Husky Health Center, tell them this number and be okay. But when you visit your in-network or out-of-network providers, we would encourage you to bring your insurance card with you. So in this same email, if you scroll down, you will find a section called Create Online Account. You could also click this link. I can share this link with everyone in a minute. It's also in that PDF that I will share with everyone. And once you click that link, you will see a web page like this. So add a plan. You will put your name there and then use the identification and suffix number that you have received from iShip to sign up and create your account. It's very important that you have a local address and the address is a correct address because Lifewise will ship you the insurance card. So you will have a physical copy of the insurance card. The physical copy of the insurance card look like this. And then you will also have an electronic version of the insurance card, which you could get from the Lifewise website once you create an account. So Lifewise, one of the option for Lifewise to get your local address is through your MyUW. MyUW and Lifewise are connected. So it's very, very important for you to double check your local address in MyUW. And if the address is in MyUW is wrong, it's likely that Lifewise, the insurance card is mailed to a different address. And it's very important to activate your Lifewise account if you want to use this insurance because Lifewise provides a lot of options. You could, just like I mentioned, you could find in-network doctors using Lifewise website. You could check claims. You could have them resend the card if you haven't received your physical card. You could have Lifewise resend you a card or get a temporary, card. You could have a digital card. So it's very important to sign up and create an account with Lifewise. If you have any trouble while you can't find the email that Lifewise sent you, if the insurance plan is not working, you're having any type of trouble setting up an account, feel free to talk to Lifewise customer service line. So this one number is over here, 800-971-1491. They do operate on normal office hours, so 5 a.m. to 8 p.m. Make sure you call them using the typical time. And it's very important for you to have Lifewise account and MyChart account because you will need your medical records if you are planning to apply for reduced course load for medical reasons, if you want to have a sick leave or former quarter drop, It's very, very important for you to have your medical records and then be able to send it to your professor and send it to various offices to perform this type of task. So I will also share the link for reduced course load and former quarter drop with everyone in the email that we send out. So let's take a look at the PDF that I want to share with everyone. So if this PDF will be sent out to everyone, and we have both an English version and a Mandarin Chinese version. I will send it both to everyone. But basically, it summarizes everything we talked about today. So first of all, in order to activate your ISHIP insurance, you need to update your local address at your MyUW account. Make sure the address there is a correct address, and you can search for Lifewise in your UW email and get your specific subscriber ID and suffix. And then you will go to this link with Lifewise, and you will be able to click for students, click ISHIP students, and you can click create an account and create an account with ISHIP and Lifewise. And once you create an account, you will be able to freely explore this website. And then if you click Find Care, you will have to sign in. Due to the time limit, I'm not gonna sign in today, but Find Care, you will be able to locate your in-network provider and out-of-network provider. And this chart give you detailed information on what to do for every single steps in creating the account. And we do have a session to activate Mychart. So if you clicking this link, it will take you to Mychart link. And if you sign in, this is your first time. I already have an account with Mychart, so I could just click sign in. But if this is your first time, you will click sign up now, and then you will click sign up without activation code option. And then it will lead you to a place to ask you to register. So you will type your name, your address, and other medical information, and then click next to sign up for Mychart. And on the very bottom of this PDF, we do have the numbers listed for Lifewise customer service, 24-hour free nurse line, and how to schedule an appointment with Husky Health Center, and different new student checklist in terms of ISHIP. So we will share this PDF with everyone, so don't worry, and you will have all this information. For winter break, and you will want to, for example, if you are sick in winter break, you can start using your iShip insurance right now. It's already activated. It goes until the end of every quarter. You will pay your iShip insurance money along with your tuition. So every time you pay your tuition, you will see a section that says iShip insurance, and then you will pay that money. So your iShip insurance will continue the entire year, every quarter, and then if you want the insurance to cover summer quarter, you also have an option to pay for summer quarter and then have it cover you throughout summer quarter as well. You could download the Lifewise app. I find this app very helpful, and then it's very easy to navigate. So use this app to find a doctor, and then search for in-network doctor, urgent care, pharmacy, dentist, and all other informations. And that's what we have for today. I will have some time for a Q&A, and I hope everyone be safe and healthy. Thank you so much.